what we're doing is really assessing what's the future of telemedicine. And for us, I think the future of telemedicine is being able to really expand our reach, minimize lengthy visits that may be of little or no value to patients. So let me give you a couple of examples of what we're doing. Since we take care of young people all the way with all kinds of problems, all the way up to the Oregon border, which is about 6 hours, we're now, and most of the young people that we care for, provide our specialty services to in those areas, come to us with a 6 hour car ride. They then have a relatively short visit, and then they have to drive 6 hours back. So what we're doing is doing a video visit with those patients, either in their home, or another model that we're working on developing is seeing them when they're in their primary care doctor's office and working with his or her primary care clinician, whether it be a nurse practitioner or physician, that can do the vital signs, that can provide us with the data, that can draw the blood for what they have to be do, and that we can really it's almost a tripartite thing where we're here, the patient and family is here, and the primary care doctor is here, and it's just a wonderful model to really extend our reach, but also do a little bit of teaching to primary care clinicians up there, so they're learning more about how to manage some of our patients, and really cut down the financial burden on the families and the young people to get the care they need. Another area that I'm concerned about is the quality of care and access. So I told you our access looks pretty good, but I continue to be concerned about access for low and middle income people who may have trouble getting to us. So we have to keep paying attention to that issue. And the other thing is this: how do we know we're doing the same quality of care and are patients satisfied with this care? I think it's more likely, as I said earlier, to really have a hybrid system where you incorporate what's best about telemedicine with what's best about seeing people in person. You can't give vaccines to young people if they don't come into your clinic, if you're giving vaccines. And one of the things that we have hit upon is that many of our patients who were scheduled to come in for sports physicals, for school sports, their families have decided not to bring them in because many families are still very anxious about coming to a clinical setting because of COVID. They don't want to risk the health and well-being of their kids or themselves. So here we are with immunizations being critical at this time, critical for the flu vaccine, critical for the meningococcal vaccine, critical for Tdap, all of these adolescent vaccines, and we're really worried that our adolescents aren't getting these vaccines.